What does a healthy ear look like?
So it's where it's kind of translucent.
Okay.
You're going to see kind of the reflection of the light coming back, which is called the cone of light.
Oh, it sounds like something out of Indiana Jones. Indiana Jones and the Cone of Light.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now here are your hosts, Dr. Jordan Strong and Kevin Ziener.
Welcome back to another episode of Ask an Audiologist. I'm Kevin Ziener.
And I'm Dr. Jordan Strong.
Courtesy of Dr. Al Turi of the Village's Health. Today, Dr. Jordan and I will be chatting about otoscopic examinations. Did I say that right?
Sure.
I feel like I want to say
exam.
Otoscopic. That's wrong. Otoscopic exams.
Mm-hmm.
And of course, when I say we, I mean like the royal we, Dr. Jordan, will discuss, and I will just kind of like be in the room too. So, otoscopic.
That's right.
Exams.
Mm-hmm.
What are they? Who are they? Why do we need them?
Yeah.
Take it away.
Yeah, you've probably had this done at your primary care physician visits.
Okay.
Where they take that light, they look in your ears. More than likely, everybody's kind of had this done before, whether or not it's been with an audiologist or an ear, nose, and throat doctor.
Got it.
Or if this has been done with just your primary care physician.
Okay.
So what that means is that we're going to take a light that also has magnification on it, and we're going to take a look at your outer ear, your ear canal, and your eardrum. So it's just looking at kind of the overall health of everything.
Sure.
Is there anything there? Is there earwax going on? Even things on the outside of the ear, we're looking at, is there, I've even seen things like skin cancers where we're like,
really?
This might be something that you need to go have your...
With the otoscope, you're able to determine? Oh,
absolutely.
Okay.
I mean, obviously I'm not diagnosing
Sure.
skin cancer, but I'm like, this is a spot that may be concerning. Because we don't always look at the top of our ear, you know? So even looking for things like that aren't down into the ear canal.
Got it.
Yeah.
So I think you're right. I think everybody's first experience with this is sometimes in elementary school, right? The nurse, you're lined up with your class and she's just looking at every individual ear. I want to say back when I was in elementary school, I don't think they changed the cap on the otoscope a lot. I just think we all got the same cap. And then at some point somebody said, that's not healthy. Don't do that. But I think we all, I in that moment, none of us really knew what was being looked for. We just assumed was part of being a kid, that you just get stuff shoved into your ears. So you use that light, you use that magnification. Obviously you can find things like earwax or, God forbid, a foreign object in there. And then, as you mentioned, skin cancer. What else in that process are you trying to look at? Can you look at like the health of the eardrum?
That's right.
Can you see like are you looking at is the ear canal big, small, medium? Like what else? And like if you're assessing everything, the things that you probably check the list with 1,000 times, what else are you looking for there?
Yeah. So we're definitely looking at even like the flight path, which is like, how's the ear canal shaped? Does it have a hard turn in it? Does it go up? Does it go down? What is the shape of it? What's the size? We're looking at the eardrum to see, does it look healthy? Is there anything behind the eardrum that we need to be concerned about?
Follow-up question. What does a healthy ear look like?
Yeah, absolutely. So it's where it's kind of translucent.
Okay.
That eardrum's going to be a little bit purulent. You're going to see kind of the reflection of the light coming back, which is called the cone of light.
Oh, it sounds like something out of Indiana Jones.
It kind of
Indiana
does.
Jones and the Cone of Light.
It kind of does.
Yeah.
So we're looking for that. We're looking to see, if there's a hole in the eardrum.
Oh, wow. Okay.
That's called a perforation.
Okay.
We're looking for anything like that. Yeah.
Got it. So there's like dozens of things that you're like mentally assessing while
check. Yeah, absolutely.
Wow. That's interesting because obviously I don't know the depth of what you know, but I just assume the first thing that you're looking at is like, well, is there earwax? Great. No. And then something along the lines of, is the eardrum perforated? No. Okay, we're good to go.
Yeah.
But there's so much more.
There's so much more.
To
right.
It.
Yeah.
So if somebody has like a healthy ear that even just has like a light amount of wax, whatever, you're pretty good.
Yeah. Yeah. I mean, as long as we can get a clear picture of the eardrum and the ear canal, I'm okay with it.
Is that often the case? Give me a ratio breakdown of like, okay, healthy people, great.
Probably 70-30.
Healthy to not healthy.
Yeah.
Okay.
Yeah, I would say so.
And so then not healthy would be anything that we kind of discussed as well. But like, what would be like hyper unhealthy? A cockroach.
Oh yeah. Yeah, for sure. Bug in the ear.
Yeah.
A really nasty ear infection.
Okay.
Yeah.
What does an ear infection look like with an otoscope?
So it depends on if it's on the external part, if it's in the canal.
Okay.
So like that's when you get otitis externa, where it can happen frequently with like kids in the summer and they're swimming all the time. They're getting all that water in there and it just kind of sits.
Got it.
Then they can get externa. It can be really red. We call it an angry ear.
Got it.
Or it can be behind the eardrum where there's some fluid behind the eardrum that it can make the ear, the tympanic membrane, the eardrum look kind of yellow or white. Sometimes there can be a fungus in the ear canal and that looks like kind of like little white dots everywhere.
A fungus in the ear. So I was going to say, how can you see behind the eardrum, but you're saying it changes colors, which is kind of how you know.
Yeah. So when a healthy eardrum is going to be kind of clear.
Got it.
So anytime that we look at it and we see it's kind of dull, or sometimes you can actually see fluid bubbles.
I was going to say, it looks like a little fishbowl back there.
It kind of does. Yeah. Yeah, in a way.
Terrifying. Absolutely terrifying. So I think all of us who have had that exam, it takes like 10 seconds, right? At the most.
Right.
That's usually what it should take. I guess if something is wrong, it takes a little bit longer. Yes. Or as I've seen on sometimes I've been in a practice, so I've gone on these philanthropic endeavors. Somebody will say, take a look at this, and then they pass the otoscope to somebody.
Not a good sign.
Yeah, as the patient, you're like, well, I'm going to be here a little longer now, right?
Yes, that's exactly right.
So though it's very cursory, it obviously plays an extremely important role in the audiology kind of path towards health. What else? What else am I forgetting to ask? What am I missing here?
I mean, you really checked most of the boxes there. I mean, you mentioned passing that around. So that's when we use video otoscopy. Okay. Which is really fun.
Sweet.
We would like that. We can take a picture. And then that can even be useful for like following up with that patient down the road.
Okay.
So if we take a picture of it today, we send you to an ENT to go have that looked at. And then you come back, we can kind of look at a pre and post. Where are we?
Got it.
So video otoscopy can be really useful. And then, of course, we just have the normal otoscope that you typically see us holding.
Sure.
Yeah.
And is that routine like for anybody who comes in? That otoscope is getting put in their ear.
Definitely.
Every single time.
Yes.
And is that just to make sure that like everything that was good before is now still copacetic?
Yeah, absolutely.
I love the video thing because I feel like, and tell me I'm wrong, like the video component is what, when we see earwax extractions, that's what's being used?
Yep, that's exactly right.
It's like, is it an otoscope that's connected to?
Yeah, most of the time sometimes they're wireless, but most of the time it's just a video otoscope. They'll just record it. Some of them record, some of them just take pictures, some of them do both.
Got it.
And that's what you're typically seeing whenever you watch his wax removal videos.
Got it.
Really get in there and see all the nitty gritty.
Got it.
Those are all done with a video otoscope.
Obviously, I was going to take this to earwax removal, but do you have the dexterity? Are you good with an otoscope and like a curette? Can you do that?
I do.
Oh, that's amazing.
I love that. So I'm actually left-handed.
Oh, no way.
But I do everything else right-handed.
Okay.
So I kind of have a feel for both, if you will. So I guess that kind of helps me whenever I'm doing wax removal and things. I'm using the otoscope and a curette. Yeah.
We learned a little bit about Dr. Jordan today. She's
Fun
ambidextrous.
Fact. Sort of.
Kind of. Enough to be considered loosely ambidextrous.
Accurate.
What else am I missing? Is there anything else that I'm missing about an otoscopic examination?
Not really. Have it checked out.
Perfect.
Yeah.
Well, to learn more about this topic and anything else audiology related, please visit askanaudiologist.com. And of course, we thank you in advance for going there. Dr. Jordan, we did a great job today. Thank you.
Absolutely.
We'll see you guys next week.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.
The best hearing loss treatment that money can pay for. And the clearest, most concise way is to say that it's vague. And so let's start by talking about what's not a good option for you.
Perfect.